We are back with Dr. Clara Dillingham with Cone Health Plastic Surgery Specialist. We're talking about skin health and ways to protect your skin in the summer months. Okay, so there can be a lot of irritants around summertime. You got the heat, you got the humidity, you got the sand, you got the sun. So what steps should we consider to help prevent or soothe our skin from all of that?
Your moisturizer is really good, and then really getting on that, we're back to that skincare regimen, which is really important to calm down the irritants from the day. And the Sente and the Zeo are really good. For example, the Sente is a really good one that helps with the pigment that you get from the sun. Even when you wear your sunblock, you're still going to get some pigment, especially if you're colored like you and I are. We look at it and we're going to get a burn. That really helps with the pigment, and the pigment leads to those dark raised spots called your seborrheic keratosis that are really hard to get rid of once you get them.
Does it matter if you wash your face with hot or cold water, or warm or cold water?
Warmer water is going to be better for opening up your pores.
Oh, okay. All right, so we mentioned facials a little bit earlier. What are some other options for healthy skin that people maybe might not have thought about before but should?
Well, Tanya, let me show you this, because this is a really interesting picture. Here is a daughter and her mother, and you can see the aging process that's taken place. And so in this picture, you can see where we've got nice fullness in the cheeks. We have very little wrinkling, very little hyperpigmentation. So filler in this area would do really well and take away that drawn down, tired look. Pigment in this, or Botox in this area would do really well. And then laser. So with that pigment, I'll tell you about laser, because that's probably one of my favorite things because it's so effective. There are a couple of different kinds, and it's based on sort of the depth that you're wanting to get to. So if you're wanting to get to the pigment, there's very little downtime, maybe, a few hours where you're a little bit red, but several consecutive treatments about a month apart, and you can see some remarkable difference in the pigment. And then you can go with some deeper lasers, and it's based on the wavelength, and those you're going to have a little more downtime, like 4 or 5 days, but you're going to get collagen stimulation, which is going to help with the wrinkling and the jowls. It's just amazing to see.
Okay, so you can use lasers instead of like getting a facelift.
There is nothing that is as wow as a facelift. However, the facelift time, you're talking about 2 weeks downtime, the risk of the surgery, the cost of the surgery. So there's nothing that really replaces the full effect of a facelift. But if you do some of the lasers and the skincare regimen, you may not need a facelift.
Okay. Are there some common misconceptions about these kinds of options that you'd like to set straight?
I think the biggest one is the danger of it. If you're doing it at a reputable office with board certified physicians who know the equipment, then you're in safe hands, because the downside to the lasers is really burn and pigment problems. So you have to be careful with that. Once in a while, we'll do a test dose for some of the patients who have the darker skin types to make sure that it doesn't cause darkening of the skin or lightening of the skin. So it could go either way. But I think that's probably the biggest one. The other is people fear the pain of it. But with a cream that we put on, I'm a wimp and I can do it.
Okay, we have about like 45 seconds. If someone has questions about how to improve their skin health, what do they do? Where do they go for that?
So we're located on Church Street. We're with Cone Health, plastic surgery specialists. We have physician assistants. We have a wonderful esthetician, really just a fabulous team. I have a partner, Dr. Taylor, and as a group, we really enjoy seeing patients and really helping them meet their goals for healthy skin and good looking skin, and they go hand in hand.
Well, thank you so much for your time and your expertise in answering those questions about the routines that we should do, especially in the morning and night. If you missed any of this, this is going to be in the To Your Wellbeing section of our website.